With me right now is Sir Michael Marmot with the University College London. Thank you so much for being here. I know your work focuses really on the social determinants of health, and I guess my question is, why do we need to focus on that?
We know that when people get sick, they need access to a high-quality healthcare system. The social determinants of health is addressing the question of why people get sick in the first place, and that ill health, and particularly inequalities in health, are not simply due to lack of access to healthcare. They're due to the conditions in which people are born, grow, live and work and age, and inequity in power, money and resources that give rise to inequities in the conditions of daily life. And that's what I mean by the social determinants of health. And we should address them because they are the fundamental drivers of inequalities in health. And setting it right is a matter of social justice. People make the argument, no government will take you seriously unless you can make the economic case. It'll save money. Maybe, but that's not my case. My case is one of social justice.
Considering that health inequity is such a great problem, how do we address that specifically?
I've spent a lot of time trying to bring together the evidence on what we can do. The evidence is key because we can make lots of mistakes just proceeding with good intentions. So the evidence is absolutely central. And we need to take action through the life course. In my English review of social determinants, I had 6 domains: early child development, education, employment and working conditions, minimum income. Everyone in a rich society should at least have the minimum necessary for a healthy life. The 5th one is healthy and sustainable places to live and work. And the 6th is what I call taking a social determinants approach to prevention.
You talk about equity and equality. You use both of those words. A lot of people use them interchangeably, but you say it's important to differentiate.
Well, so firstly, you notice I don't use the word disparity, which tends to be used in the US for a variety of reasons. I think equality frightened the horses a bit. Equality doesn't fit with the US model of doing things very well. The way I use the words, the systematic inequalities in health between social groups that are judged to be avoidable by reasonable means and are not avoided are unfair, hence inequitable. So inequity refers to those inequalities that are judged to be avoidable by reasonable means and are not avoided. And that's why the overriding purpose is social justice, to set right these inequities in health.
Okay, thank you very much.
My pleasure.